Hello everyone and welcome to this presentation. My name is Stacey Brown, Head of the General Assessment Team here at the Veterinary Medicines Directorate, and in the next 10 to 15 minutes I will be giving you a brief overview of the VMD's response to COVID-19 and the challenges that have been faced and overcome by the veterinary medicine sector as a result. Firstly and importantly, a brief introduction or reminder for some as to what Vader is. Don't worry, it's not as ominous as it may sound. Vader is the VMD's Emergency Response Plan and stands for Veterinary Medicine Availability and Disease Emergency Response. On paper, Vader's main aims are first and foremost to support the continued supply of veterinary medicines in an emergency scenario, whatever the cause. This is not restricted to the current pandemic we are faced with, but may include any emergency scenario that may have an implication on the veterinary medicine supply chain. Secondly, it is to feed into the wider DEFRA emergency response plan and manage the role of the VMD in a disease outbreak scenario where relevant. In practice, Vader is a team of individuals within the VMD with specific subject matter expertise covering a whole range of policy across the veterinary medicine sector, working collectively to manage the emergency scenario in collaboration with other affected DEFRA colleagues. The emergency plan and team were established in advance of COVID-19 following the UK's departure from the EU. The experience has meant that we were able to quickly stand up a response team to the new challenges that have been faced by our sector as a result of COVID-19. The principles of our emergency response plan very much build on the VMD's well-established mechanisms for handling and communicating shortages. Fundamentally, this involves regular communication with various key players within the supply chain, including, of course, yourselves as marketing authorization holders or industry body representatives, wholesale dealers, and obviously other government departments, including colleagues such as those in the Department of Health and Social Care, for example. The plan offers consideration to a risk-based hierarchy of options in the event of a critical national shortage of veterinary medicines that affects animal and public health and welfare. In response to the novel challenges that are continuing to be faced by COVID-19, our Vader response team was stood up from March of this year. So here is a closer look at the structure and function of the Vader team, specifically in respect to the COVID-19 pandemic. More specifically, our overarching aim has been to provide expert policy advice on matters affecting veterinary medicine manufacture and availability, to escalate any arising issues to the DEFRA emergency team colleagues for situational awareness and, wherever possible, resolution, and lastly, to ensure accurate and timely comms are issued to our stakeholders, which has been very important for us. Again, as I said on the prior slide, we are a small team of VMD staff covering multiple roles dependent on our area of expertise. These roles have included identification and resolution of supply issues, management of incoming queries, an issue of relevant communications, subject matter experts in specific areas of policy, and liaison points with other government departments. Out with this, we have continued to deliver our business as usual function and continue to engage and liaise with yourselves to ensure we meet our targets as set out within our published standards. So that's our structure and function, but how have we kept informed of any arising issues during this time? Firstly, to put the scale of our involvement into perspective, we have received and responded to over 240 commissions from our DEFRA emergency team colleagues. These commissions or asks have had very tight deadlines for replying, meaning that we have worked in a very reactive headspace for the past 8 months. We have also balanced these with incoming inquiries from yourselves as our stakeholders, ensuring that we issue timely comms containing key messages of relevance where possible. These commissions have covered a range of issues that have often required questions and discussions with yourselves. The collation of feedback and information is typically taken the form of a short questionnaire. However, we have also proactively cascaded information of interest where possible, for example, on the availability of antigen testing for the sector. We are very much grateful for your time in responding to our questionnaires, which have included asks to marketing authorization holders regarding availability of your authorized products and considerations towards the resilience of your supply chain. This has allowed the VMD to maintain an awareness of the health of the veterinary medicine supply chain, determine if there are any vulnerabilities, mitigate supply issues where possible, and issue messages of reassurance on gov.uk. We are still very much keen to maintain an awareness and need your help in order to do so. If you are a UK marketing authorization holder and are aware of a supply issue for one of your marketed products, either current or foreseen, please download and complete our Report a Supply Problem form available on gov.uk, sending it to our supply mailbox at supply@vmd.gov.uk. This mailbox is monitored between 9 AM and 5 PM Monday to Friday, and should we require any further information or clarification from yourselves to identify or review the supply issue, we will contact you directly. Over the next 2 slides, we will cover how the VMD have adapted to the pandemic, both as an office and as a regulator. As soon as we heard about the lockdown back in March of this year, the VMD's business continuity plan was implemented at very short notice to enable staff to work remotely. 98% of staff were able to work remotely, and our inspectors were repurposed to carry out other tasks within the VMD during the lockdown, where on-site inspections were not possible. This was the first time that we had fully implemented our business continuity plan, and the IT support was crucial to make this happen. All staff were provided with VPNs to allow access to the VMD systems. Staff were also given the support that they needed to ensure that they had internet access to continue to deliver the services to our stakeholders. In addition, this was supported by the provision of an allowance for staff to purchase equipment to allow them to work at home. We have also been mindful of staff well-being during this time. We have produced internal guidance which has been made readily available to staff to support said staff well-being, which is continually being reviewed and updated. During this time, we have kept in touch with yourselves as our stakeholders through various channels, such as providing regular updates on gov.uk on the availability of veterinary medicines, also, as previously mentioned, through the circulation of relevant information and survey requests, and also through direct interaction with meetings such as those with NOAA and their membership. As some of you will be aware, these meetings have been extremely beneficial and allowed us to gain information from marketing authorization holders on any issues that have arisen, and also given ourselves at the VMD the opportunity to raise any concerns. Legislative facilitations were introduced and in place until the end of August. In response to the unique challenges posed by COVID-19, the VMD temporarily relaxed the enforcement of specific provisions within the veterinary medicines regulations. These applied to vets and SQPs to facilitate the supply of veterinary medicines during this time. From the 1st of September, these can still be applied if there is a local lockdown, or the veterinary surgeon or SQP needs to self-isolate or have tested positive for COVID-19, or due to contact tracing. We have also adapted some of our processes to accommodate remote working. These have included paper-based inspections, and we have introduced a system to issue export certificates electronically during this time. We do hope that you have found these changes helpful. And lastly, a look to the future. We are continuing to work with yourselves to ensure we have a continued supply of veterinary medicines in the UK in the months ahead. As part of this, we are looking at any potential mitigations to shortages to ensure that we have this continuity of supply. One of these is to work with yourselves to look into the possibility of diversifying active ingredient manufacture, for example. We are facilitating all of this by engaging with you through our surveys, which has proved very useful as previously mentioned. We hope that this has also given industry the opportunity to share any views or concerns that you may have. We value the good relationship that we have with yourselves as our stakeholders and are very much pleased to hear from you. If you do need to get in contact with us about anything in relation to this presentation or in relation to a foreseen or current shortage, please do email us at our supply mailbox, which once again is supply@vmd.gov.uk.
The VMD welcomes any questions that you might have. To ask your questions, please go to www.slido.com and use the event code 96607. Slido will be open for your questions until Friday the 20th of November. Responses will be published to your questions by Friday the 27th of November. If this presentation hasn't met your accessibility needs, please email director.support@vmd.gov.uk. Thank you.